Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, June the 9th. Unfortunately, since last media briefing, our province lost another individual to COVID-19. On behalf of the entire province, please let me express my condolences, thoughts, and prayers to the family, loved ones, and friends of the deceased. I'll now turn things over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us. Since the media advisory yesterday, we've had 3 new confirmed cases of COVID-19 in our province. The first is in Central, and the individual is under the age of 20, and the case is under investigation. And we have 2 in the Western Health Region that were previous presumptive positive cases and are under investigation. The total number of cases in our province is now 1,360. And there have been 12 new recoveries, 1 in Eastern, 3 in Central, and 8 in Western Health. And there are now 53 active cases in the province. 1 person is in hospital, and a total of 151,796 people have been tested to date. Sadly, as reported yesterday, we had another death in the province Monday night due to COVID-19. I offer my sincere sympathies to the family and friends of the individual. This brings the total number of COVID-related deaths in our province to 7. I would like to thank the more than 2,000 individuals in the Western region that came forward for testing. And while voluntary asymptomatic testing in the region has now concluded, anyone with symptoms, even if mild, even if only one, should book a COVID test. We have confirmed that there are separate investigations ongoing in the region involving 2 variants of concern, B1617, originally identified in India, and B117, which was originally identified in the UK. In the Stephenville area investigation, most people who have been recently identified as positive have been a contact of a case. However, very recent cases remain under investigation, as does the initial source of the outbreak. To date, we have not seen widespread transmission in the community. However, the investigation is still actively ongoing. In the St. George's area, there has not been evidence of widespread community transmission, and information from community testing, as well as other aspects of the investigation, is being assessed to determine if further testing is needed. The region will therefore remain in Alert Level 4 for the time being, and we anticipate reevaluating this by the end of the week. We know that there have been social gatherings in the affected areas that have contributed to the spread of the variants. We remind individuals in the regions that gatherings at this time are not permitted, and you should only have contact with those in your household. If you have been contacted by public health and identified as a close contact of a positive case, you must follow public health directions. Regardless of where you are living in the province, we all need to get into the habit of assuming a symptom of COVID means that you could have COVID. You should get tested even if you have one mild symptom. This is particularly important as we ease restrictions and permit more travelers to enter the province. And an important part of living with COVID and easing restrictions is maintaining our ability to detect and contain any new cases. And the only way to do that is if people get tested. At this time, everyone must continue to adhere to public health requirements regardless of their vaccination status. We know that 1 dose of vaccine offers good protection against severe COVID-19 disease. However, all recent evidence indicates that 2 doses of the vaccine offers better protection, particularly against the B1617 variant, which we are detecting in our province. A person is considered to be fully vaccinated when at least 1 week has passed since their final 2nd dose of COVID-19 vaccine. We have been receiving inquiries with regard to infections after vaccination, and I'd just like to give a little update on that. So to date, we have had 56 people in the province that have tested positive for COVID-19 after being immunized. 22 of those people were not considered to be protected as they have received the vaccine less than 14 days prior to their infection date. 32 were not considered fully immunized, as they were either more than 14 days after the first dose or less than 1 week after their second dose when they became infected. There have been 2 breakthrough infections post-vaccination in that they were more than 1 week after the second dose when infected. Only 3 of these 55 cases were considered to have had severe disease. Making the choice to be vaccinated is critical to protect yourself, your family, and your province. Every person vaccinated adds to that layer of protection, and every dose counts. Over 323,000 people in our province have had at least 1 dose of vaccine, which is about 67% of the eligible population. We are starting to see the number of fully vaccinated individuals rise as well. There are over 17,000 people fully vaccinated, and we anticipate this figure will go up quickly in the coming months as we offer second doses sooner. Last week, we announced that second dose appointments can be moved forward for those who have second dose appointments from July 16th to August the 5th. The number of appointments available per region may vary and is based on vaccine availability. Our priority is ensuring that those over 70 have an opportunity to be fully vaccinated before July 15th. It's important not to jump the queue if you're not in the group eligible to rebook the second dose appointment. Continue to look for updates regularly on the provincial vaccine site, as well as your local regional health authority website. When booking appointments online, individuals should make sure that they select the right type of appointment and do not select a dose 1 appointment to book their second dose appointments. As announced last week, people who have had 1 dose of AstraZeneca vaccine now have 2 options for their second dose. They can choose to receive a second dose of AstraZeneca, or they can receive an mRNA vaccine for their second dose, such as Pfizer or Moderna. Furthermore, in accordance with recent NACI recommendations, anyone who received a first dose of an mRNA vaccine, that's Pfizer or Moderna, can receive either vaccine for their second dose if the vaccine they received for their first dose is not readily available. This will really help us to deliver second doses much more quickly. These individuals can book second dose through regional health authority vaccination clinics, or they can schedule an appointment at a pharmacy or their physician's office if either is offering the vaccine, provided it is at least 8 weeks since their first vaccination. Nationally, the epidemiology is very promising, with a 32% reduction in new COVID cases reported this past week. All provinces are now reporting decreases, and this trend bodes well for our province, given that our greatest risk is the importation of cases through travel. We remain on track to enter the transition phase of our reopening plan on June 15th, which is less than a week away. And in the transition phase, we will start to ease some public health measures within the province. And while the limit for indoor gatherings remain the same, the maximum for formal outdoor gatherings will increase to 150, and informal outdoor gatherings will increase to 30. Outdoor sports tournaments can proceed as part of return-to-play plans, and businesses can gradually begin to bring employees back into the workplace. In order for us to move to step 1, permitting non-essential travel, there are specific criteria that must be met. 75% of people aged 12 and older in our province must be vaccinated with at least 1 dose, and we must have low COVID-19 counts and hospitalizations. If we meet this criteria, and at this time all indications are that we will, then we move to step 1 on July 1st. For travel up to and including June 30th, all special measures orders remain in place. With travel restrictions in place for over a year, I know there are many Newfoundlanders and Labradorians waiting anxiously to reunite with family and friends. There will be a new travel form that individuals must complete before they arrive in the province, and this form will be available closer to the reopening date. We are working through the details of implementing this new process, and more specific details will be announced in the coming weeks. Anyone traveling internationally must consult the Canadian Border Services Agency on permissions to enter the country and self-isolation requirements, as these may be different from provincial requirements. As a recap, for those just joining us, we have 3 new confirmed cases and a total of 1,360 cases in the province. As we prepare to ease restrictions in the coming weeks, please be kind. I know for some it will take time to overcome the fears and anxieties that COVID brought with it. We must move forward and adapt to living with COVID, and I have every confidence that we are ready and able to do so. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Over 323,000 Newfoundlanders and Labradorians have now been vaccinated with at least one dose. And in Labrador Grenfell Health, 75% have gotten one dose, and 16% have been fully vaccinated. A great milestone for Labrador Grenfell Health. So please keep up the efforts towards vaccination. It is, as Dr. Fitzgerald said, our best defense to COVID-19, and you getting a vaccine actually protects people you love, your neighbors, your friends, your colleagues. I'll now turn things over to Dr. Haggie for some brief remarks.
Thank you very much, Premier. Once again, we see a falling case count, which is always welcome. And our case count follows that of the rest of Canada, down by around 30% to 8.2 per 100,000 and 53 active cases. In there, however, living with COVID, we will from time to time see clusters. Shout out to St. Paul's Intermediate in Gander, where there are investigations ongoing around a presumptive positive case there. We'll get through it and we'll come out the other side. The mainstay now of our efforts has to be around vaccination. COVID is not an all or a none condition. It can produce no symptoms at all. It can produce mild symptoms or symptoms severe enough to require a hospital admission. The vaccine protects against each of these stages. It protects against getting the disease in the first place, and it protects against the severity of symptoms if you were one of those people to get it. The reduction in severity is significant, and if you look across the country, we have seen significant changes in mortality and risk to the elderly, for example, who bore the brunt of the first wave. Get the shot. This is the way you protect yourself and you protect others. I've had mine. All the members of my family have had at least one shot. My wife has had two. This is what you can do. Interestingly enough, the same choice is being made by a lot of people. After our last availability, in one day we had 30,000 appointments registered for shot one in a single day. So at 67% currently, with on average 1% more per day, we're well on track to reach our 75% target. And once we have our achieved that and gone as far as it seems to be that we will go, we're actually in the situation where we are likely to get a boost, a bump, if you like, from the federal supply chain. There's talk of significant influx of Moderna. This we can distribute through pharmacies and through physicians' offices to make second doses easier still and to catch those people who may have missed first doses. So get the shot and hold fast. So thank you very much, Premier.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
I want to ask about the number of people who have still gotten COVID despite being vaccinated. When you look at July 1st and having 75% of our population with one dose, there's still going to be a fairly small number that are going to be fully vaccinated. So in light of the fact that we have seen 32 examples of people who have had one dose but have still gotten COVID, how concerned, or what would you say to people who are concerned that as we see more people traveling from other parts of the country where there continue to be cases of COVID, that it could lead to the possibility of introducing new cases here?
So I think what we have to remember is that even though we see cases after one dose of the vaccine, that the severity rate certainly seems to be lower. So that's reassuring. we are, we have been working really hard up until this point with vaccines coming in to try to keep COVID out as much as possible, but that's not going to be possible forever. So we are going to have to find a way, and I guess we all have to kind of get our heads around living with the fact that there are going to be cases of COVID in our province, but with protection for all of us, we won't see those severe outcomes in the same way that we might have before. So I think, going forward with the vaccinations, with people being vaccinated and increasing that all the time, especially second doses, I think we will, while we might see cases, we won't see the same severity that we did before, and it won't have the same impact that potentially it could have had before. So, and this is, the evidence will evolve as we vaccinate more people. We'll have to reevaluate our recommendations, all of that with regard to what we do when someone's fully vaccinated and exposed to COVID, for example. So I think, I understand that people have anxiety, but I think the vaccinations will certainly help us to be able to respond in an effective way.
I know it's difficult to measure people who didn't get COVID because they were vaccinated, but can you give me an idea with the two outbreaks that we've seen in Central and on the West Coast? How are they different from earlier outbreaks, considering that we did have, at least amongst certain age groups, a fairly high level of vaccination?
So with regard to vaccination rates, I think, you have to take into account that the outbreaks themselves were different in that we were dealing with different variants that had a different infectious rate and had a different effect on severe disease. But certainly, and it's you can't really do a direct comparison one outbreak to another because you are dealing with different things. So I think at this point we have seen, certainly we have seen in the Central outbreak specifically that we've had a few cases of people who've had vaccines and have still developed disease, but the severity of the disease seems to be lower.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, sorry about that. Did the man who died this week, over the age of 70, had he received at least one dose of the vaccine?
So, Peter, I can't really speak to someone's personal health information as to whether or not they had a vaccine. I'm sorry.
Okay. Nova Scotia's chief medical officer recommended one of the mRNA vaccines over AstraZeneca's second shot. Are you recommending it, or are you just leaving it completely up to choice?
So right now what we're recommending is that people can make a choice based on the information that they have and their own comfort level. Certainly what we've seen from the evidence that we have so far is that people get a good response with the mRNA vaccine, and in some studies we're still awaiting final results out of another study in the UK. So I think once we have more information, we may be able to be a little more firm on that recommendation, but at the moment it is still a person's choice once they look at all the information and make an informed decision.
Thank you.
Our next questions are from Elizabeth Witt with All Newfoundland and Labrador. Please go ahead.
Thank you. As the province begins to reopen and welcomes back travelers, has there been any further consideration on this part of this government for vaccine passes for travelers?
Sorry, Elizabeth, was that a comment on vaccine passports?
Yes. I'm wondering what your stance is on it.
Well, I think the plan still requires proof of vaccine, and we're working on presumably the logistics of that over the next little bit. But Dr. Fitzgerald, you can comment on the form per se and how you upload it.
So at the moment what we're asking for is for anyone who's traveling into the province, and then they can upload that to the travel form, or that will be the goal, that they'll be able to upload that through the travel form, and that reconciliation will be done so that when they get to the point of entry, they'll have an indication of, what their isolation and testing requirements will be based on their vaccine status. With regard to vaccine passports per se, that in and of itself, I guess, is not a vaccine passport. We are working right now on a way that allows anyone who's in the province to be able to get their vaccine record, should they need it for travel, or if for other reasons that they may need it. Certainly. These are questions that we're looking at, and these conversations are happening at all levels. Even at the larger tables across the country that we sit at.
Thank you. And as we're about to enter the transition period next week, that leads into the reopening plan. I was hoping to get some clarification on one comment in the reopening plan, which is beginning the gradual return to workplace and offices. And since the beginning, you've mentioned people, if they can work from home, should. But can you clarify what the gradual return is?
So I think it just means that employers have to think about. So if you have employers who had the most of their workforce working from home throughout the pandemic, then now they can consider if it's going to work for them, if they want to bring people back in. So they start with people they feel are the most urgent to get back into their offices, and then just gradually increase the number that are coming back as we start to see more higher vaccination rates. So it is. I guess it'll be as varied as there are businesses or employers out there as to how they want to do that. But it's not sort of opening the doors and bringing everybody back at the same time. It's just a gradual, stepwise progression to be able to get the workplace, people back into the workplace if that's what employers choose to do.
Thank you. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. In regards to the case at St. Paul's Intermediate, we've heard that school will be reopening tomorrow, and that public health has advised that no change is needed in school operations. We're hearing from parents who are concerned. Why go this route? Why recommend that, given the role that schools have played in past outbreaks recently?
Minister, do you want?
Thank you very much, Richard. I've been chatting with Minister Osborne. The decision about closing the school was simply an operational one, and there may be a variety of reasons, some of which I'm not privy to. I am aware that under circumstances, for example, where some teachers may have been exposed, there may be some issue of adequate resources to hold classes, that kind of thing. So I would direct the mechanics of that to the school district or to the Department of Education. I mean, public health supplies their recommendations, and those recommendations, as we've seen, may change from time to time, but that's their current one, that the school does not need to close from a public health perspective. So watch this space.
And still on that topic, a parent at St. Paul's Intermediate reached out to us, and she says that her child was identified as a contact, was tested, and has to isolate until June 17th, regardless of a negative or positive result. But she told us that teachers don't have to isolate if given a negative test result. So, Dr. Fitzgerald, I was hoping if you could clarify why is that the case.
So isolation and quarantine depends on the type of interaction that someone may have with a positive case. So if someone is considered a very close contact of a positive case, then they are going to have to isolate quarantine for 14 days after their last known exposure to that case. If someone is considered a very transient contact or a lower risk contact, if, for example, in this situation, if they weren't in the classroom for a prolonged period of time, then those people may not be considered a close contact by public health. And while they may recommend testing, they may not recommend quarantine for those people. So it has to do with the nature of the contact that the person had. So it's not a blanket statement about all teachers or all students. It's like public health will interview every one of those people who are considered close contacts and make a decision about what their quarantine has to be.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I'm looking for clarification around once we hit step one of the reopening and allows for travel, why rotational workers who may be fully vaccinated but returning from an outbreak site their requirements are different than somebody who's traveling from what was known to be hotspots in Canada but is fully vaccinated. Why that difference?
So we know that the outbreak sites that we've had have certainly seeded a lot of cases here in the province, and certainly were our biggest risk for importation of disease. And as a lot of these sites now will start to be vaccinating more people, we expect that the number of outbreaks that we see at these sites will go down. So I don't know that it's going to be a huge problem going forward, but certainly initially we anticipate there will be some outbreaks, and we know that that's our biggest risk for importation, or it has been our biggest risk for importation. And in some places, the rates have been higher than what we see in a larger city or something like that. So we're certainly we're playing it cautious. It's certainly the amount of time that people have to isolate is still quite low compared to what it was. But we do feel we need to have that extra reassurance of a negative test.
Thank you. And you may have already covered this in the preamble, but I think I missed it there. With the second dose schedule, I've had a lot of people reach out that because their second dose is scheduled in July 1st to 15th, or they had their shot at a period of time in March, a lot of people reaching out concerned that they feel they're being missed as an opportunity to do their second dose, and they qualify under some of our more vulnerable I'm thinking people who are 75 and older that have reached out. Why can't they move their second dose?
So our goal was to try to get as many people 70 plus vaccinated by July 15th. We will, by doing this one move of that group, that cohort of vaccination appointments, we will get most of the people who are in the 70 plus group vaccinated by July 15th. So logistically, it just made sense to do one move instead of two, I guess, and to, everybody will still be done by that July 15th mark, which is really what we need to see. These are decisions that are made on a population health basis and what is the most fitting for, most protective for the population. So that was why the decision was made to move that one group.
Thank you. And just to flag on the technical side, I think that the YouTube feed is struggling a little bit.
I didn't do it.
Nope,
We'll
not me.
check into that. I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, and that's about the timing of reopening. The tourism industry had asked for a July 1st opening, and that's the date we went with. How much did their calls and their needs influence the decision to open up on that date?
Well, Peter, I think when making a decision to reopen or shut things down, it's a balance of public health, first and foremost, with the situation that we're currently in. So, including, continued downward pressure on the economy and in particular, tourism operators and other businesses. But Dr. Fitzgerald and her team, I'm not going to speak for her, but certainly balanced all considerations, most important of which is the safety, public health and safety of Newfoundlanders and Labradorians. Dr. Fitzgerald, I don't know if you have a further comment on that.
No, I think you've covered it.
Okay.
Thanks.
Peter Jackson with the Telegram, do you have a final question?
I think you're on mute, Peter.
Sorry about that. Dr. Fitzgerald, earlier on you gave a breakdown of cases where someone was vaccinated for more than a week and cases where someone was the vaccine hadn't had a chance to kick in. I'm just wondering, in those numbers, were there any cases in which a person had been vaccinated for more than a week and the symptoms were serious?
So are you asking if people who were fully vaccinated, considered fully vaccinated, had severe disease? Is that what you're asking?
No, I'm asking if any case of someone who had one shot but had a full week had passed since that shot.
So we did have 3 cases that would be considered severe out of those 55. Right. Yeah, so does that answer your question?
No, but you said that, I think there were 23 cases where the vaccine had not had.
22 cases who were not yet protected because they were less than 2 weeks prior to, one dose less than 2 weeks prior, yeah.
And I'm asking whether those 3 severe cases were in that group or in the group where the protection should have been there.
I don't actually have that information right here, but we can see if we can get that for you, Peter.
Okay, I appreciate that. Thank you.
Yeah.
Elizabeth Witten with All Newfoundland and Labrador, do you have a final question?
Yes, I do. I'm wondering, has there been any decisions on when to hold COVID briefings in person at the Confederation building again?
We're still looking at that and doing an analysis of the space available and where's best to set up the communication center. So we will have an update shortly. I apologize, we don't right now.
Thank you.
Richard Duggan with VOCM, do you have a final question?
I do. Hearing of people in the 80-plus category who have been trying to move up their second dose appointments, but have been told they can't. Wondering, what's the reason why someone in that age group wouldn't be allowed to bump up their appointment?
So I'm not sure. It depends on when they had their first dose. So we are recommending that most people have 8 weeks in between doses. That seems to be when, there's evidence right now that says that that slightly longer dosing interval seems to be providing a better immune response. So we are asking that people be 8 weeks between their doses, up to 16 as we had before. So if somebody had not been 8 weeks in between the doses, I suppose the recommendation may have been that they wait to get their vaccine, their second dose. But I don't know of any specific cases, Richard, that you're talking about. And Peter, I do have an answer for you. I'm sorry, it was written here in my notes, but I just missed it. There was one case out of the 55 who was considered not yet protected, who had severe disease.
Thank you.
Kellyanne Roberts with NTV, do you have a final question?
Yes, it was released yesterday, the vaccination status by age grouping. Thank you for that. But is there any group that you're overly concerned about that seems to be lagging behind? The vaccination seems fairly high, if not really high throughout, but is there one age group that you're concerned about?
I mean, at the moment, I think it's a bit difficult to say because we're, what we're seeing there in lower percentages in the lower age groups just has to do with the way that our vaccine program was rolled out. In that ages, people who are older would have gotten the vaccination first, right? So they would have more time to get vaccinated. So, I mean, we're seeing excellent uptake in certainly in groups 65 plus, and in 55 plus, we're seeing good uptake as well. And every day we're seeing more and more people in the other age groups. So at the moment, there's nothing that's jumping at us as very concerning. We do know that traditionally younger age groups tend not to be as quick to get vaccinated, for example, with influenza vaccine. So that is something we'll be watching, and we certainly do encourage anybody out there who's 12 and over to get their vaccination, because it will protect not just you, but your loved ones and your communities. So it's really important to book a vaccine.
Thank you.
Thank you, everyone, and apologies to those who had trouble with the feed today. There were some technical issues. Premier, do you have any final comments for today?
Thanks for joining us today. Please keep up the hard work and do your part and get vaccinated. Of course, you can also help out by downloading the COVID-19 app, and certainly that will help as we reopen. So stay safe, Newfoundland and Labrador. We're almost there, but we're not there yet. Please do your part. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.